You, Sunil. Thank you, chairpersons. So after the fantastic lectures from Sanket, then Dr. Saxena and Milind, I'm just going to start with recent advances in stem cell therapy, promising treatment for hard to heal diabetic foot ulcers, which Milind have already shown. The cost of diabetic foot ulcer is it's not moving. It's not moving. Yeah. Rita? Yeah. Just a minute. Cost of diabetic foot ulcer is greater than that of most five most common cancers. So remember this is very important. And lifetime risk of diabetic foot ulcer is 34%, not 15 or 25%. Means every third patient of diabetes in their lifetime is going to have a diabetic foot ulcer. So these are the typical presentation as Milind have also shown. This we found these are neuropathic ulcers and these are the ischemic ulcers. So these are the hard to heal ulcers. So where you will want, and this slide have already been shown by the Milind, and you can see what I put in the last. This is a stem cell therapy, which I'm going to discuss. It's a new thing, but it's still in experimental state. I think there will be a lot of queries and a lot of things to be discussed. But in just 10 minutes time, I've tried to give you a glimpse of this stem cell therapy. So this is the paper where effectiveness of stem cell therapy for diabetic foot ulcers is systemic review and great compliant bootstrapped meta-analysis of randomized clinical trials. It was a total of 20 studies where more than 1300 participants were there, and what they have shown that study or investigation should prioritize large scale randomized double blind placebo controlled multi-center trials having long-term rigorous follow-up protocols, then only you can go ahead. This paper was published recently in 2024 in the International Journal of Lower Extremity Wounds. And this is the point which I want to mention. Stem cell therapy in India is still considered to be experimental as per the ICMR Council of Medical Research. So how a lot of hospitals may offer you, but still considered experimental for diabetic wounds and diabetic foot ulcers. So only one thing about the Stempeutics which I am going to discuss, they have got a approval. For what they have got, that you have to understand. Then stem cell therapy emerged as a promising avenue in the treatment of diabetic foot ulcers, a common and challenging complication of diabetes. This is the process of cell therapy. You can see how this is the bone marrow you have to take from the iliac crest, and these are the mesenchymal stem cells and mononuclear cells here. Centrifuge it and you have got the bone marrow and inject peri wound area around 0.75 centimeter away from it. And what is the dose of the this stem cells? Around 25 millions, not more than that at a time. Means around 0.6 million per centimeter of wound is to be given. Then there are two types of stem cell. One is autologous, and then other one we are going to discuss, which is much more better. And Stempeutics, what is say? Autologous stem cells include bone marrow derived from the bone marrow mesenchymal cells and the bone marrow mononuclear cells, blood derived stem cells, peripheral blood mononuclear cells, then adipose derived uh, stem cells, and autologous adipose derived stromal cells. All these trials are going on all across the globe. So this is the approval to the Stempeutics, where this is a very important part. You have to read it carefully. No option patients of CLI due to either Burgess disease or critical limb ischemia due to atherosclerotic PAD, peripheral arterial disease in Rutherford class 3 or 4, or even I can say at the last, no revascularization treatment is possible with rest pain and ulcers in the affected limb, where you can use this Stempeutics or the stem cell therapy. Mechanism of action, we all know there's inflammation, then cell proliferation and remodeling. And how it comes: interleukin 8, vascular endothelial growth factor, angiogenesis, TGV, and cell migration, then angiogenesis, ECM synthesis, all these things, how it goes on. Types of stem cells which are used: mesenchymal stem cells, induced pluripotent stem cells, adipose derived stem cells, embryonic stem cells, and peripheral blood stem cells. So how stem cells exert their therapeutic effect on the context of DFUs? Regenerative potentials, they have got anti-inflammatory properties and trophic factor release. Immunomodulation, collagen production, ECM remodeling, and angiogenesis reduction. So stem cells can have an influence on many pathophysiological process, and still these are the probable, but still we don't know a lot of things how it works. And ulcer healing by stimulated tissue repair selective increase the synthesis of the extracellular matrix and promoting the angiogenesis in the ischemic tissue. Some animal studies have proven that stem cell implantation results in improved blood flow circulation in the ischemic limb. Then the autologous stem cells means emerged as a novel promising therapy for ulcer healing, and the first human trial was held in 2002. And GIVAS, Jain Institute of Vascular Sciences, where Professor Dr. K.R. Suresh is there. He's a vascular surgeon. He is also one of the part for this trial, and it was again the patients where there was no way was there, neither angioplasty could have been done, neither revascularization by the pedal plasty plus pedal bypass has not been possible. In that situation, critical limb ischemia, they have used it and they found the good results. So bone marrow derived stem cells, how you will take it? Take around 30 to 50 ml from the, you aspirate from the posterior superior iliac spine, and you have to do either anesthesia or give a spinal anesthesia. Take 30 to 50 ml, centrifuge, and then separate the mesenchymal cells and the polynuclear cells. And isolation methods are two. This is the Ficol and harvest systems. So these are two studies, Dash et al. And Wu et al., and which have shown the combination of autologous mesenchymal stem cells and the platelet rich gel is got help when they give the intramuscular. So about the root also I'm going to discuss about that, is very important. Then about the allogenic stem cells, you remember it. One is autologous, other is allogenic. Allogenic means stem cells isolated from individuals of the same species but not from the recipient are considered allogenic. So Stempeutics, what they have done, they have taken 3 healthy volunteers and they have aspirated the bone marrow and then they have made it, and after that it has been infused and it is available commercially now, but only no option patient has to be used with it. It's a costly affair because stem cell therapy is very costly. Route of administration, there are different route of administrations are there. So 2 routes, local and systemic. Systemic is IV, so it is not recommended because the cells will reach there and going to act, but it's not useful. It's a local injection or IM injection. So what you do, you mark the anatomy of the anterior tibial and posterior tibial arteries and inject the this stem cells and at that level, and that is going to help. So how it is a local delivery? Topical application, you see, topical injection, scaffold, gel, or artery and vein. So but the most commonly used is the topical injection or scaffold gel therapy. So it either IV or local injection or step cell laden scaffold. Most commonly used the local injection. Then route of administration is still don't know, but IM administration with the local injection. Peri-ulcer area around 0.75 centimeter away from the peri-ulcer area, you can inject it, and it is to the same of tune that. So about the stem cell based therapy, promising treatment for diabetic foot ulcer. This was again a very recent paper in which they have shown stem cell based therapy is promising in the field of regenerative medicine, but more studies are still needed to validate the findings. So challenges, what are the challenges for stem cell therapy? Optimizing cell type and doses, then patient selection criteria, cost and accessibility. In India, even the Stempeutics, the cost is around 1.5 lakhs, but otherwise outside in different hospital, it might be around 15 lakhs of rupees for this one therapy. About this again, mesenchymal stem cell therapy in diabetic foot ulcer, and update comprehensive review, and what the conclusion was. Incorporation of mesenchymal stem cells in the management DFU highlight their potential as a feasible therapeutic strategy. Establishing comprehensive understanding of the complex relationship between DFU pathophysiology and mesenchymal stem cell therapy and related obstacles is essential for optimizing therapy outcomes and maximum patient benefits. Again, this is for the meta-analysis which has been done in the 14 studies, 683 participants, and what they have shown that stem cells are significantly more effective than traditional methods in treatment of diabetic foot and can improve the quality of life of patients after treatment. But still, future studies should conduct large-scale randomized controlled blind placebo-controlled trial, multicentric multinational trials to validate the use. This is the intralesional autologous stem cell application in diabetic foot ulcer. How this was the first day, and then at the end of the 16 weeks and 32 weeks, you can see the miraculous results. And to conclude, my dear friends, stem cell based therapy in DFU is promising in the field of regenerative medicine. One, their therapeutic mechanisms include promoting angiogenesis, secreting paracrine factors, stimulating vascular differentiation, suppressing inflammation, improving collagen deposition, and immunomodulation. Stem cell based therapy is effective in wound healing and decreasing the amputation rates. Very important. It is better to have a allogenic rather than autologous, because in autologous you have to give anesthesia, either spinal or general anesthesia. It is a painful procedure. It takes around 3 hours to aspirate the bone marrow, and then you inject. But if you'll have a if you'll have a allogenic marrow, you can inject directly. But only thing is, if when you giving the allogenic stem cell, always give the P medication, hydrocortisone plus avil injection, that is to be done. So more studies with larger scales and different administration routes are needed, as most of the studies reported show results from stem cells applied rather than systematically. More studies are required to determine the ideal type of stem cell needed in therapy, their safety, the proper dosing, and optimal administration route. But only thing what I want to give the message is this: still it's a experimental as per the ICMR, Council of Medical Research. So mind it. Only thing is, in the difficult or no option, you can use it. Thank you very much.